Question 1. Upon reviewing a patient's intake form, you note they reported their weight as 150 pounds. During the in-office measurement, the scale reads 165 pounds. The patient appears to be of average build, and there are no obvious signs of significant edema or recent major weight loss. How should you proceed with the anthropometric assessment? Option A. Immediately disregard the reported weight and proceed with the assessment using only the measured weight, assuming the reported value was inaccurate. Option B. Gently inquire about potential reasons for the weight difference, such as recent changes in diet, fluid intake, or medication, to understand the context of both measurements. Option C. Use the measured weight for all calculations, but make a mental note to adjust future recommendations based on the assumption that the patient may not be accurately reporting their weight. Option D. Directly question the patient about the accuracy of their reported weight, suggesting that the discrepancy indicates a misunderstanding or misreporting. The correct answer is B. Gently inquire about potential reasons for the weight difference, such as recent changes in diet, fluid intake, or medication, to understand the context of both measurements. Explanation. Scenario analysis. This scenario presents a common challenge in anthropometric assessment where a patient's reported weight significantly deviates from their measured weight. The professional challenge lies in how to address this discrepancy ethically and effectively, ensuring accurate assessment without alienating the patient or compromising the integrity of the nutritional care plan. The dietitian must balance the need for precise data with patient rapport and trust. Correct approach analysis. The correct approach involves a gentle, non-judgmental inquiry into the discrepancy. This aligns with ethical principles of patient-centered care and professional integrity. By asking open-ended questions about potential reasons for the difference, the dietitian demonstrates respect for the patient's autonomy and encourages honest communication. This approach allows for a more accurate understanding of the patient's current state, considering factors like recent fluid shifts, medication effects, or even a misunderstanding of the measurement process. This is crucial for developing an individualized and effective nutrition care plan, as mandated by professional practice standards that emphasize accurate data collection and patient collaboration. Incorrect approaches analysis. One incorrect approach involves immediately disregarding the reported weight and solely relying on the measured weight without further investigation. This fails to acknowledge potential patient factors that might explain the discrepancy and can lead to a strained professional relationship. Ethically, it overlooks the importance of patient self-reporting and can create an environment where patients feel unheard or distrusted, potentially impacting future adherence to recommendations. Another incorrect approach is to confront the patient directly about the perceived inaccuracy of their reported weight, implying dishonesty. This is unprofessional and unethical, violating principles of respect and non-maleficence. Such an approach can cause significant distress to the patient, damage the therapeutic alliance, and lead to the patient withholding important information in the future. It also fails to consider legitimate reasons for weight fluctuations. A third incorrect approach is to proceed with the assessment using the measured weight, but making assumptions about the patient's lifestyle or adherence based on the discrepancy, without any dialogue. This is a failure of due diligence and can lead to inaccurate assessments and inappropriate interventions. It bypasses the opportunity to gather crucial contextual information that could inform the assessment and care plan, thereby compromising the quality of care provided. Professional reasoning. Professionals should approach discrepancies in anthropometric data with curiosity and a commitment to understanding. The decision-making process should prioritize open communication, patient respect, and the pursuit of accurate contextualized data. When faced with such a situation, the professional should 1. Acknowledge both reported and measured values. 2. Gently inquire about potential reasons for the difference using open-ended questions. 3. Observe the patient's reaction and adjust the approach accordingly. 4. Document the discrepancy and the discussion. 5. Use the most reliable data available, informed by the patient's input, for assessment and planning. Question 2. The evaluation methodology shows that a client expresses concern about general fatigue and asks for advice on improving energy levels, specifically inquiring about the benefits of taking a broad-spectrum mineral supplement. The client has no diagnosed medical conditions, but admits to a diet that is often rushed and may lack variety. What is the most appropriate initial professional response for a certified dietitian nutritionist, CDN, in this situation? Option A. Conduct a comprehensive dietary assessment to identify potential nutrient gaps, evaluate the client's current intake of major and trace minerals, and discuss the role of diet in energy metabolism before considering any supplementation. Option B. Suggest that the client try a popular, over-the-counter mineral supplement marketed for energy, as these are generally safe and effective for most individuals experiencing fatigue. Option C. Immediately recommend a high-dose, multi-mineral supplement to address potential deficiencies and boost energy levels, as fatigue is a common symptom of mineral imbalances. Option D. Advise the client to focus solely on increasing their intake of iron and B vitamins, as these are the most common culprits for fatigue, and suggest a specific iron supplement. The correct answer is A. Conduct a comprehensive dietary assessment to identify potential nutrient gaps, evaluate the client's current intake of major and trace minerals, and discuss the role of diet in energy metabolism before considering any supplementation. Explanation. This scenario presents a professional challenge due to the complex interplay of mineral functions, potential deficiencies, and the risks associated with supplementation, all within the regulatory landscape governing Certified Dietitian Nutritionists, CDN. A CDN must navigate scientific evidence, individual patient needs, and ethical considerations to provide safe and effective recommendations. The challenge lies in distinguishing between evidence-based practice and unsubstantiated claims, particularly concerning mineral supplementation, which can have significant health implications if misused. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment before recommending any intervention. This aligns with the ethical and regulatory obligations of a CDN to practice within their scope, grounded in scientific evidence and patient-centered care. Specifically, it emphasizes understanding the patient's current dietary intake, health status, and potential risk factors for mineral imbalances. This thorough evaluation ensures that any supplementation recommendation is justified, safe, and addresses a diagnosed or highly probable deficiency, thereby minimizing the risk of toxicity or adverse interactions. This approach adheres to the principles of evidence-based practice and patient safety, which are paramount in the CDN profession. An incorrect approach that suggests widespread, indiscriminate supplementation with multiple minerals without prior assessment fails to meet professional standards. This is ethically problematic as it exposes the patient to unnecessary risks of toxicity and financial burden without a clear benefit. It also violates the principle of practicing within one's scope by making recommendations without adequate diagnostic information. Furthermore, such an approach disregards the potential for mineral interactions, where excessive intake of one mineral can interfere with the absorption or function of another, leading to unintended consequences. Recommending supplements based solely on general health claims or popular trends, without considering individual needs and scientific evidence, constitutes a failure to uphold professional responsibility and could lead to patient harm, a direct violation of regulatory guidelines that mandate safe and effective practice. Another incorrect approach that focuses on addressing perceived deficiencies solely through high-dose supplementation, without considering dietary sources or the underlying cause of the deficiency, is also professionally unacceptable. This overlooks the fundamental role of diet in mineral status and may mask underlying medical conditions that require different interventions. It also increases the risk of exceeding safe upper intake levels for certain minerals, leading to toxicity. Ethically, this approach fails to provide holistic care and may not address the root cause of the patient's health concerns. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough patient assessment. Gather detailed dietary history, medical history, current medications, and lifestyle factors. 2. Evidence-based evaluation. Consult current scientific literature and establish dietary guidelines regarding mineral requirements, functions, and risks of deficiency and toxicity. 3. Risk-benefit analysis. For any proposed intervention, including supplementation, carefully weigh the potential benefits against the risks of toxicity, interactions, and financial costs. 4. Individualization. Tailor recommendations to the specific needs, health status, and goals of the individual patient. 5. Monitoring and follow-up. If supplementation is recommended, establish a plan for monitoring the patient's response and adjusting the plan as needed. 6. Scope of practice. Ensure all recommendations and interventions fall within the established scope of practice for a certified dietitian nutritionist. Question 3. Examination of the data shows a patient presenting with elevated LDL cholesterol, low HDL cholesterol, and moderately elevated triglycerides. The patient reports a diet high in saturated fats and refined carbohydrates, with a sedentary lifestyle. The patient has no other diagnosed chronic conditions. Considering the Certified Dietitian Nutritionist, CDN, scope of practice and relevant dietary guidelines for cardiovascular health, which of the following represents the most appropriate initial nutritional intervention strategy? Option A. Inform the patient that their lipid profile is within acceptable limits for their age and no dietary changes are necessary at this time. Option B. Develop a personalized medical nutrition therapy plan focusing on reducing saturated and trans fat intake, increasing soluble fiber, incorporating sources of omega-3 fatty acids, and recommending regular physical activity. Option C. Advise the patient to immediately begin taking a high-dose omega-3 fatty acid supplement to address the triglyceride levels. Option D. Provide the patient with a generic low-fat diet handout and instruct them to follow it without further personalization. Correct answer is B. Develop a personalized medical nutrition therapy plan focusing on reducing saturated and trans fat intake, increasing soluble fiber, incorporating sources of omega-3 fatty acids, and recommending regular physical activity. Explanation. This scenario presents a professional challenge due to the need to interpret complex lipid profiles in the context of patients' overall health and potential cardiovascular risk, while adhering to established dietary guidelines and ethical practice. The Certified Dietitian Nutritionist, CDN, must synthesize information from laboratory data, patient history, and current nutritional science to formulate a safe and effective intervention. The challenge lies in moving beyond simple data reporting to providing actionable, evidence-based recommendations that are tailored to the individual and align with regulatory expectations for professional practice. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered assessment. This involves not only understanding the implications of abnormal lipid levels, but also considering the patient's lifestyle, dietary habits, and existing health conditions. By recommending a personalized dietary plan that addresses specific lipid abnormalities, e.g., high LDL, low HDL, and incorporates evidence-based strategies for managing cardiovascular risk factors, the CDN is acting within the scope of practice and adhering to professional ethical standards that mandate individualized care and the application of current scientific knowledge. This approach also implicitly aligns with the regulatory framework by promoting public health and preventing disease through evidence-based nutrition interventions. An incorrect approach that focuses solely on reporting the abnormal lipid values without providing context or actionable recommendations fails to meet the professional standard of care. This is a regulatory and ethical failure because it neglects the CDN's responsibility to translate data into meaningful guidance for the patient, potentially leaving the patient uninformed about their risks and how to mitigate them. Another incorrect approach that suggests a generic, one-size-fits-all dietary modification without considering the patient's specific lipid profile and overall health status is also professionally unacceptable. This represents a failure to provide individualized care, which is a cornerstone of ethical practice and often implicitly or explicitly required by regulatory bodies overseeing the profession. Such an approach could be ineffective or even detrimental if it doesn't address the specific underlying lipid metabolism issues. A further incorrect approach that involves recommending over-the-counter supplements without a thorough assessment of their necessity, potential interactions, or evidence base for efficacy in managing the patient's specific lipid disorder is a significant regulatory and ethical concern. This bypasses the established process of medical nutrition therapy and could lead to inappropriate or harmful self-treatment, potentially delaying or interfering with more effective medical or dietary interventions. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly review all available data, lab results, medical history, lifestyle factors. Second, identify the specific nutritional issues and potential health risks indicated by the data. Third, consult current, evidence-based guidelines and research relevant to the identified issues. Fourth, develop a personalized nutrition intervention plan that is safe, effective, and tailored to the patient's needs and preferences. Fifth, educate the patient about their condition and the rationale behind the recommendations. And finally, establish a plan for monitoring progress and making necessary adjustments. This process ensures that interventions are grounded in scientific evidence and ethical practice, meeting the expectations of regulatory bodies. Question 4. Performance analysis shows a certified dietitian nutritionist, CDN, is evaluating a patient presenting with reported fatigue and unintentional weight loss. The patient also mentions experiencing mild, intermittent nausea. The CDN has access to the patient's electronic health record, which includes their medical history and a current medication list. What is the most appropriate initial approach for the CDN to take in assessing this patient's nutritional status? Option A. Prioritize a detailed physical examination to identify any overt signs of nutrient deficiencies, such as skin changes or edema, and base the initial assessment solely on these physical findings. Option B. Focus primarily on the reported nausea and fatigue, recommending dietary adjustments to alleviate these specific symptoms without further investigation into other contributing factors. Option C. Conduct a comprehensive review of the patient's medical history, current medications, and reported symptoms, alongside an assessment of their functional status and dietary intake, to identify potential causes and contributing factors to the weight loss and fatigue. Option D. Initiate a detailed inquiry into the patient's recent dietary intake patterns, assuming that the weight loss is solely due to reduced food consumption and overlooking the impact of medical history and medications. The correct answer is C. Conduct a comprehensive review of the patient's medical history, current medications, and reported symptoms, alongside an assessment of their functional status and dietary intake, to identify potential causes and contributing factors to the weight loss and fatigue. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified dietitian nutritionist, CDN, to synthesize information from multiple sources: medical history, physical examination findings, reported signs and symptoms, functional status, and medication review to accurately assess for malnutrition. The complexity arises from potential interactions between medications and nutritional status, subtle physical signs, and the subjective nature of reported symptoms. A failure to integrate all these components can lead to misdiagnosis, delayed intervention, and suboptimal patient outcomes, potentially violating the standard of care expected of a CDN. Correct approach analysis. The correct approach involves a comprehensive and integrated assessment. This aligns with the CDN's ethical and professional responsibility to provide evidence-based, patient-centered care. Specifically, it reflects the requirement to consider the holistic health of the patient, recognizing that medications can directly impact nutrient absorption, metabolism, and appetite, thereby influencing nutritional status. A thorough review of the medical history, physical examination, and patient-reported symptoms, alongside functional status and medication review, allows for nuanced understanding of the patient's nutritional risks and needs, which is crucial for developing an effective nutrition care plan. This comprehensive approach is implicitly supported by professional practice guidelines that emphasize thorough patient assessment as the foundation for nutrition intervention. Incorrect approach is analysis. One incorrect approach involves focusing solely on reported symptoms of fatigue and weight loss without a thorough review of the patient's medication list. This fails to acknowledge the potential iatrogenic causes of these symptoms, such as medications that can cause gastrointestinal distress or alter metabolic processes. Ethically, this is a failure to exercise due diligence and can lead to an incomplete or inaccurate assessment, potentially delaying appropriate medical or nutritional management. It also neglects the professional obligation to consider all contributing factors to a patient's condition. Another incorrect approach is to prioritize the physical examination findings of mild edema over a detailed exploration of the patient's dietary intake and functional status. While edema can be a sign of malnutrition, e.g., protein deficiency, it can also be caused by numerous other medical conditions or medications. Without correlating this finding with other indicators of nutritional status and functional capacity, the assessment remains superficial and potentially misleading. This approach risks misattributing symptoms and failing to identify the root cause of the patient's nutritional concerns, which is a deviation from best practice and potentially harmful to the patient. A further incorrect approach is to solely rely on the patient's self-reported appetite and food intake, disregarding the medical history and current medications. A patient's perception of their intake might not accurately reflect their actual nutritional status, especially if underlying medical conditions or medications are affecting their absorption or utilization of nutrients. This narrow focus neglects critical objective data and the potential for hidden nutritional deficits, representing a failure to conduct a comprehensive and scientifically sound assessment. Professional reasoning. When faced with a patient presenting with signs and symptoms that could indicate malnutrition, a CDN should employ a systematic, multifaceted approach. This begins with a thorough review of the medical history, including past diagnoses, surgeries, and current health conditions. Concurrently, a detailed medication review is essential to identify any drugs known to affect appetite, nutrient absorption, metabolism, or excretion. The physical examination should be conducted with a focus on anthropometric measurements and signs indicative of nutritional deficiencies. Patient-reported symptoms and functional status provide crucial subjective data. The professional decision-making process involves integrating all these data points to form a differential diagnosis for malnutrition, identify contributing factors, including iatrogenic ones, and determine the severity of the nutritional risk. This integrated approach ensures that the nutrition care plan is tailored to the individual patient's complex needs and is grounded in a complete understanding of their health status. Question 5. The control framework reveals that a CDN is planning a community-wide nutrition education program aimed at improving dietary habits for chronic disease prevention. The community is diverse, with varying educational backgrounds, ages, and cultural practices related to food. The CDN needs to select the most effective approach for developing and delivering educational materials and programs to ensure maximum comprehension and adoption of healthy eating principles across this heterogeneous population. Which of the following strategies best aligns with the principles of effective nutrition education within this context? Option A. Implement a technology-driven program featuring online modules and interactive apps, assuming all community members have reliable internet access and the necessary digital literacy skills. Option B. Design a program that primarily relies on distributing detailed scientific journals and research papers, with the expectation that participants with higher education levels will disseminate information to others. Option C. Develop a comprehensive set of educational materials that utilize a mix of visual aids, simplified language, hands-on demonstrations, and opportunities for interactive Q&A, while also incorporating culturally relevant food examples and allowing for participant feedback to refine content and delivery methods. Option D. Create a series of lectures delivered by the CDN, focusing on the biochemical pathways of nutrient metabolism and the latest scientific research on diet and disease, assuming participants will seek clarification if needed. The correct answer is C. Develop a comprehensive set of educational materials that utilize a mix of visual aids, simplified language, hands-on demonstrations, and opportunities for interactive Q&A, while also incorporating culturally relevant food examples and allowing for participant feedback to refine content and delivery methods. Explanation. The control framework reveals that certified dietitian nutritionists, CDN, are tasked with developing and delivering effective nutrition education. This scenario is professionally challenging because it requires a CDN to adapt their educational strategies to diverse learning styles, varying levels of health literacy, and distinct cultural backgrounds within a single community outreach program. The goal is to ensure that all participants, regardless of their individual characteristics, can understand and apply the nutrition information provided. The correct approach represents best professional practice because it prioritizes a multifaceted educational strategy that acknowledges and addresses the heterogeneity of the target audience. This aligns with ethical principles of providing equitable and accessible healthcare information. Specifically, it demonstrates a commitment to health literacy by employing a range of methods to ensure comprehension, such as visual aids and simplified language, and to cultural sensitivity by incorporating culturally relevant food examples and respecting traditional dietary practices. The use of technology, when appropriate and accessible, can further enhance engagement and reach. The evaluation component is crucial for continuous improvement, ensuring the program's effectiveness and adherence to professional standards for patient education. An incorrect approach that relies solely on didactic lectures fails to acknowledge diverse learning styles and may alienate individuals with lower health literacy, potentially violating the ethical obligation to provide understandable information. It also risks cultural insensitivity, if the content is not adapted to the community's specific cultural context. Another incorrect approach that focuses exclusively on advanced scientific terminology without simplification or visual aids would be detrimental to individuals with lower health literacy and would not be culturally sensitive if it ignores common dietary practices. This approach neglects the fundamental principle of making health information accessible. An approach that uses technology without considering digital literacy or access within the community would create a barrier to education for a significant portion of the audience, demonstrating a lack of cultural sensitivity and potentially failing to meet health literacy needs. This overlooks the practical realities of the target population. The professional decision-making process should involve a thorough needs assessment of the target community, identifying their learning preferences, existing health literacy levels, and cultural norms. Based on this assessment, the CDN should then design a flexible educational program that incorporates a variety of teaching modalities, culturally appropriate content, and accessible language. Regular feedback mechanisms and formative evaluation should be integrated to allow for real-time adjustments and ensure the program's ongoing effectiveness and ethical delivery. Question 6. Analysis of a 65-year-old male patient diagnosed with stage Roman II hypertension, hyperlipidemia, and early-stage heart failure. The patient reports a fondness for processed foods and a limited understanding of dietary sodium's impact on his conditions. He is currently prescribed a statin and an ACE inhibitor. The Certified Dietitian Nutritionist, CDN, is tasked with developing a nutrition care plan. Which of the following approaches best aligns with current U.S. regulatory frameworks and best practices for managing this patient's complex cardiovascular needs? Option A. Recommend a strict ketogenic diet to promote weight loss and improve cardiovascular markers, with a focus on eliminating all processed foods. Option B. Advise the patient to significantly reduce his fluid intake to less than 1 liter per day and eliminate all carbohydrates from his diet to manage his conditions. Option C. Implement the DASH diet, emphasizing reduced sodium intake, and educate the patient on reading food labels to identify high-sodium processed foods, while also incorporating recommendations for increased soluble fiber and reduced saturated/trans fats to manage hyperlipidemia, and advising on moderate fluid intake as tolerated for heart failure. Option D. Focus solely on the DASH diet for hypertension and instruct the patient to avoid all salt at the dinner table, without addressing hyperlipidemia or heart failure management. Correct answer is C. Implement the DASH diet, emphasizing reduced sodium intake, and educate the patient on reading food labels to identify high-sodium processed foods, while also incorporating recommendations for increased soluble fiber and reduced saturated/trans fats to manage hyperlipidemia, and advising on moderate fluid intake as tolerated for heart failure. Explanation. Scenario analysis. This scenario presents a common challenge for certified dietitian nutritionists, CDN, in managing a patient with multiple cardiovascular risk factors, including hypertension, hyperlipidemia, and heart failure. The complexity arises from the need to integrate dietary recommendations for each condition, while considering the patient's lifestyle, preferences, and potential adherence issues. Furthermore, the CDN must ensure all recommendations align with current U.S. federal and state regulations governing the practice of dietetics, particularly those related to patient care standards and scope of practice. Correct approach analysis. The correct approach involves a comprehensive, individualized assessment and the development of a personalized nutrition care plan that addresses all the patient's conditions. This includes specific, evidence-based dietary modifications for hypertension, e.g., DASH diet principles, sodium restriction, hyperlipidemia, e.g., reduced saturated and trans fats, increased fiber, and heart failure, e.g., sodium and fluid restrictions. The plan must also incorporate therapeutic lifestyle changes, TLC, that are practical and sustainable for the patient. This approach is best professional practice because it adheres to the principles of patient-centered care, which is a cornerstone of ethical and effective nutrition practice. It also aligns with the scope of practice for CDNs as defined by relevant U.S. state licensing boards and the Commission on Dietetic Registration, CDR, ensuring that interventions are within the professional's expertise and are evidence-based. The focus on education and collaboration with the patient is crucial for promoting adherence and achieving positive health outcomes, as mandated by professional standards. Incorrect approach is analysis. An approach that focuses solely on one condition, such as only addressing hypertension with the DASH diet, is incorrect because it fails to comprehensively manage the patient's multiple cardiovascular diseases. This oversight could lead to suboptimal management of hyperlipidemia and heart failure, potentially worsening the patient's overall health status and contravening the CDN's ethical obligation to provide holistic care. It also fails to meet the standard of care expected for a patient with such complex needs. An approach that recommends drastic, unproven dietary restrictions without considering the patient's individual needs or potential for nutrient deficiencies is also incorrect. Such an approach could be detrimental to the patient's health and well-being, potentially leading to unintended consequences like malnutrition or electrolyte imbalances. This would violate the ethical principle of do no harm and could be considered practicing outside the scope of evidence-based nutrition practice, potentially leading to regulatory scrutiny. An approach that relies on generic, nonspecific advice without providing concrete, actionable strategies for sodium and fluid restriction or therapeutic lifestyle changes is insufficient. This lack of specificity makes it difficult for the patient to implement the recommendations effectively, hindering progress and potentially leading to continued disease progression. This falls short of the professional standard for providing clear, practical, and effective nutrition guidance. Professional reasoning. Professionals should approach such cases by first conducting a thorough nutritional assessment, including a review of medical history, current medications, laboratory values, anthropometrics, dietary intake, and psychosocial factors. This assessment informs the development of a personalized nutrition diagnosis and intervention plan. The plan should be evidence-based, patient-centered, and developed collaboratively with the patient. Regular monitoring and evaluation of the patient's progress and adherence are essential, with adjustments made to the plan as needed. Professionals must always operate within their scope of practice and adhere to all relevant federal and state regulations governing the practice of dietetics. Question 7. The efficiency study reveals that a novel protein source significantly enhances amino acid absorption and utilization in a specific demographic. A certified dietitian nutritionist, CDN, is reviewing this study to inform dietary recommendations for a client experiencing challenges with protein synthesis due to a chronic illness. Which of the following approaches best reflects professional practice in applying these findings? Option A. Immediately incorporate the novel protein source into the client's diet at high levels, assuming the study's findings will universally benefit all individuals with protein synthesis issues. Option B. Disregard the study's findings as they pertain to a novel protein source and continue with the client's current dietary plan without further investigation into potential advancements. Option C. Recommend the novel protein source based solely on the study's positive conclusions, without assessing the client's tolerance, potential interactions with medications, or the overall dietary context. Option D. Critically evaluate the study's methodology, statistical significance, and applicability to the client's specific health status and individual protein metabolism, integrating these findings with current evidence-based dietary guidelines and the client's overall nutritional needs. The correct answer is D. Critically evaluate the study's methodology, statistical significance, and applicability to the client's specific health status and individual protein metabolism, integrating these findings with current evidence-based dietary guidelines and the client's overall nutritional needs. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified dietitian nutritionist, CDN, to interpret a study's findings on protein metabolism and apply them to a specific patient's dietary recommendations. The challenge lies in moving beyond a superficial understanding of protein requirements to a nuanced application based on individual factors and current scientific literature, while adhering strictly to the regulatory framework governing CDN practice in the specified jurisdiction. The CDN must ensure their recommendations are evidence-based, safe, and ethically sound, avoiding unsubstantiated claims or practices. Correct approach analysis. The correct approach involves critically evaluating the study's methodology and findings in the context of established dietary guidelines and the patient's unique physiological status. This aligns with best professional practice by prioritizing evidence-based nutrition care, as mandated by the CDN regulatory framework, which emphasizes the use of current scientific knowledge and professional judgment. It demonstrates a commitment to providing individualized, effective, and safe nutrition interventions, thereby upholding the ethical responsibility to act in the patient's best interest and within the scope of practice. Incorrect approaches analysis. One incorrect approach would be to immediately and uncritically adopt the study's conclusions without considering the patient's individual needs, existing health conditions, or potential contraindications. This fails to meet the regulatory requirement for individualized care and could lead to inappropriate or harmful dietary advice, violating the ethical principle of non-maleficence. Another incorrect approach would be to dismiss the study's findings entirely based on a preconceived notion or outdated information, without a thorough evaluation of its scientific merit. This demonstrates a lack of professional due diligence and a failure to stay abreast of current research, which is essential for maintaining competence and providing up-to-date care as expected by regulatory bodies. A third incorrect approach would be to overgeneralize the study's findings to all patients, regardless of their specific circumstances. This ignores the principle of personalized nutrition and the regulatory expectation that CDNs tailor recommendations to individual clients, potentially leading to ineffective or even detrimental outcomes. Professional reasoning. Professionals should approach new research by first assessing its relevance to their practice and the specific needs of their clients. This involves understanding the study's design, population, and limitations. They should then integrate these findings with existing evidence-based guidelines and their clinical judgment to develop personalized recommendations. This systematic process ensures that interventions are safe, effective, and ethically grounded, adhering to the highest standards of professional conduct and regulatory compliance. Question 8. System analysis indicates a certified dietitian nutritionist, CDN, is assessing an elderly client with mild cognitive impairment who lives at home with a supportive spouse. The client has difficulty recalling specific food items and quantities consumed over the past 24 hours. The CDN needs to gather comprehensive dietary information to develop a personalized nutrition plan that addresses potential nutrient deficiencies and promotes overall health, while also considering the client's food security. Which of the following approaches would best balance the need for accurate dietary data with the client's cognitive limitations and the availability of a caregiver? Option A. Rely solely on a comprehensive food frequency questionnaire that the client completes independently, followed by a review of their grocery shopping receipts. Option B. Administer a detailed diet history interview to the client, focusing on typical eating habits over the past month, and then ask the spouse to verify the client's responses. Option C. Utilize a combination of a brief interview with the spouse about the client's typical meals and snacks, a short food frequency questionnaire focusing on common food groups, and a 3-day food diary completed by the spouse. Option D. Conduct a 24-hour dietary recall with the client, asking them to recount everything they ate and drank yesterday, and then ask the spouse to supplement any missing information. Correct answer is D. Conduct a 24-hour dietary recall with the client, asking them to recount everything they ate and drank yesterday, and then ask the spouse to supplement any missing information. Explanation. Scenario analysis. This scenario presents a common challenge for certified dietitian nutritionists, CDN, in the United States, assessing the dietary intake of a client with limited recall ability due to cognitive impairment. The professional challenge lies in obtaining accurate and reliable dietary data to inform evidence-based nutrition recommendations while respecting the client's autonomy and privacy and adhering to professional standards of care. The cognitive impairment introduces a significant barrier to traditional assessment methods, requiring a nuanced and adaptable approach. Correct approach analysis. The correct approach involves a multifaceted strategy that acknowledges the limitations of a single assessment method and prioritizes obtaining the most comprehensive and reliable information possible under the circumstances. Utilizing a combination of a caregiver's input, a brief food frequency questionnaire focusing on common staples, and a limited food diary for a few days allows for triangulation of data. This approach is best professional practice because it maximizes the chances of capturing a representative picture of the client's intake, even with impaired recall. It aligns with ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm by providing inaccurate recommendations. Furthermore, It adheres to the general principles of the Academy of Nutrition and Dietetics Standards of Practice and Professional Performance, which emphasize the importance of using appropriate assessment tools and adapting them to individual needs. The focus on food security and access is also crucial, as these factors significantly influence dietary choices and health outcomes, and are often intertwined with cognitive function and caregiver support. Incorrect approach is analysis. Relying solely on a 24-hour recall from the client, despite their cognitive impairment, is a significant regulatory and ethical failure. This method is likely to yield inaccurate and incomplete data, leading to potentially harmful nutrition recommendations. It violates the principle of beneficence by not taking reasonable steps to ensure the accuracy of the assessment. Similarly, attempting a detailed diet history without caregiver involvement would be problematic. A diet history requires detailed recall and understanding of food preparation and consumption patterns, which would be severely compromised by cognitive impairment. This approach fails to adequately address the client's limitations and could lead to misinterpretations of their actual dietary habits. Using only a food frequency questionnaire without any other method would also be insufficient. While a food frequency questionnaire can provide information on usual intake patterns, it lacks the specificity of a 24-hour recall or food diary for quantifying actual consumption and identifying specific nutrient shortfalls or excesses. This approach risks oversimplifying the client's dietary landscape. Professional reasoning. When faced with a client with cognitive impairment, the CDN should first assess the extent of the impairment and identify potential sources of reliable information, such as family members or caregivers. The CDN should then select and adapt assessment tools accordingly, prioritizing methods that can accommodate the client's limitations. This might involve using simpler language, shorter recall periods, or involving a proxy respondent. The CDN must also consider the client's environment and resources, including food security and access, as these are integral to dietary patterns and health. Documentation of the assessment process, including the rationale for chosen methods and any limitations, is essential for professional accountability and continuity of care. Question 9. Research into the hydration and electrolyte status of a patient with congestive heart failure and chronic kidney disease reveals significant edema, a history of recent vomiting, and laboratory results indicating hyponatremia. The patient's physician has initiated diuretic therapy. As a certified dietitian nutritionist, CDN in New York State, what is the most appropriate and ethically sound course of action? Option A. Recommend the patient discontinue their diuretic therapy temporarily until their electrolyte levels stabilize, as diuretics can exacerbate electrolyte imbalances. Option B. Immediately consult with the patient's physician to report the findings and discuss collaborative management strategies, including the need for further medical assessment and potential adjustments to the treatment plan, while also preparing to provide evidence-based dietary recommendations for fluid and electrolyte management tailored to the patient's specific condition and prescribed medications. Option C. Provide the patient with general guidelines for fluid restriction without consulting the physician, assuming the edema is solely due to fluid overload and the hyponatremia is a secondary issue. Option D. Advise the patient to significantly increase their sodium intake to counteract the hyponatremia, as this is a common dietary recommendation for electrolyte balance. The correct answer is B. Immediately consult with the patient's physician to report the findings and discuss collaborative management strategies, including the need for further medical assessment and potential adjustments to the treatment plan, while also preparing to provide evidence-based dietary recommendations for fluid and electrolyte management tailored to the patient's specific condition and prescribed medications. Explanation. This scenario is professionally challenging because it requires the certified dietitian nutritionist, CDN, to navigate a complex situation involving a vulnerable patient with multiple comorbidities and a potentially life-threatening electrolyte imbalance. The CDN must balance the immediate need for intervention with the patient's autonomy and the established treatment plan, all while adhering to professional standards and regulatory guidelines. Careful judgment is required to ensure patient safety and well-being without overstepping professional boundaries or making medical diagnoses. The correct approach represents best professional practice because it prioritizes patient safety and collaborative care within the CDN scope of practice. By recognizing the severity of the situation and the need for immediate medical attention, the CDN acts ethically and responsibly. Consulting with the physician ensures that the patient receives appropriate medical management for the electrolyte imbalance, which is outside the CDN's direct scope. Simultaneously, the CDN's role in providing evidence-based dietary recommendations for fluid and electrolyte balance, tailored to the patient's specific condition and medical treatment, is crucial for long-term management and prevention of recurrence. This approach aligns with the CDN's ethical obligation to practice within their scope, promote patient well-being, and collaborate with other healthcare professionals. Adherence to New York State public health law and the regulations of the New York State Education Department for certified dietitian nutritionists is paramount, ensuring that all actions are legally and professionally sound. An incorrect approach that involves directly administering or adjusting intravenous fluids or electrolyte supplements would represent a significant regulatory and ethical failure. This action would constitute practicing medicine without a license, a direct violation of New York State public health law, and the scope of practice defined for CDNs. Would also breach the ethical principle of practicing within one's competence and scope. Another incorrect approach, such as dismissing the patient's symptoms as minor or unrelated to fluid and electrolyte balance without further investigation or consultation, would be a failure to uphold the ethical duty of care. This could lead to delayed or misdiagnosis of a serious medical condition, potentially harming the patient. It also fails to utilize the CDN's expertise in assessing hydration and electrolyte status through dietary intake and patient history. A third incorrect approach, such as providing generic dietary advice without considering the patient's specific medical condition, current medications, and the physician's treatment plan, would be professionally inadequate. While dietary recommendations are within the CDN scope, they must be individualized and integrated with the overall medical management. Failing to do so could lead to ineffective or even harmful dietary interventions, undermining patient care and potentially conflicting with medical orders. The professional reasoning process for similar situations should involve a systematic assessment of the patient's condition, identification of potential risks and needs, and a clear understanding of the CDN scope of practice. When a situation presents with potential medical urgency or requires interventions beyond the CDN scope, the primary responsibility is to ensure the patient receives appropriate medical care. This involves prompt communication with the physician or other designated healthcare provider. Concurrently, the CDN should leverage their expertise to provide evidence-based nutritional support and education that complements the medical treatment plan, always prioritizing patient safety and collaborative care. Question 10. Compliance review shows a certified dietitian nutritionist, CDN, in New York State is consulting with a parent concerned about a specific ingredient in their infant's current formula, expressing anxiety about its potential long-term effects, despite the infant appearing to be growing well. The parent is requesting a change to a different formula or an earlier introduction of solid foods. What is the most appropriate initial course of action for the CDN? Option A. Immediately recommend switching to a different formula that the parent has researched, as parental preference is paramount in infant feeding decisions. Option B. Conduct a thorough assessment of the infant's growth, development, and current feeding patterns, and engage in a discussion with the parent to understand their specific concerns and provide evidence-based information regarding infant nutrition and formula options. Option C. Advise the parent to introduce a variety of solid foods at this stage to reduce reliance on formula, as this is a common parental concern. Option D. Reassure the parent that their concerns are unfounded and that the current formula is universally recommended, discouraging any changes to the feeding plan. The correct answer is B. Conduct a thorough assessment of the infant's growth, development, and current feeding patterns, and engage in a discussion with the parent to understand their specific concerns and provide evidence-based information regarding infant nutrition and formula options. Explanation. Scenario analysis. This scenario presents a common challenge for certified dietitian nutritionists, CDN, in New York State, balancing parental preferences with evidence-based infant feeding recommendations, particularly when a parent expresses concerns about a specific formula ingredient. The challenge lies in providing accurate, non-judgmental guidance that respects parental autonomy while ensuring the infant's optimal nutritional status and development. Adhering to New York State regulations for dietetic practice. Correct approach analysis. The recommended approach aligns with best professional practice by prioritizing a thorough assessment of the infant's current feeding, growth, and development, and by actively listening to and validating the parent's concerns. This approach is ethically sound, promoting a collaborative relationship between the CDN and the family. It also adheres to New York State's professional practice guidelines, which emphasize individualized care, patient education, and the use of evidence-based interventions. By gathering comprehensive information before making recommendations, the CDN can ensure any proposed changes are appropriate and safe for the infant, considering potential risks and benefits, and aligning with the New York State Education Department's Board for Dietetics and Nutrition's scope of practice. Incorrect approaches analysis. Recommending an immediate switch to a different formula without a comprehensive assessment is a regulatory and ethical failure. It bypasses the crucial step of evaluating the infant's current feeding adequacy and growth trajectory, potentially leading to inappropriate nutritional interventions. This approach neglects the individualized nature of nutritional care mandated by New York State regulations, and could be considered practicing outside the scope of practice if not based on a thorough assessment. Dismissing the parent's concerns about the formula ingredient without further investigation is also a professional failing. It undermines the therapeutic relationship and can lead to parental distrust. Ethically, CDNs are expected to be empathetic and responsive to patient concerns. From a regulatory standpoint, ignoring parental input can hinder effective care planning and adherence to recommendations, potentially impacting the infant's well-being. Suggesting the introduction of solids before the recommended age solely based on the parent's anxiety about formula ingredients is a significant regulatory and ethical breach. New York State guidelines, like national recommendations, emphasize age-appropriate introduction of solids to prevent potential health issues such as choking, gastrointestinal distress, and nutrient imbalances. This approach prioritizes parental anxiety over established infant development milestones and nutritional science, potentially jeopardizing the infant's health and development. Professional reasoning. When faced with parental concerns about infant feeding, a CDN should employ a systematic, patient-centered approach. This involves 1. Active listening and empathy to understand the root of the concern. 2. Comprehensive assessment of the infant's growth, development, and current feeding patterns. 3. Education based on current evidence-based guidelines and New York State regulations. 4. Collaborative decision-making with the parents, presenting options with their respective risks and benefits. 5. Ongoing monitoring and follow-up to ensure the effectiveness and safety of any interventions. This process ensures that care is individualized, ethical, and compliant with professional standards. Question 11. The audit findings indicate that a certified dietitian nutritionist, CDN, has reviewed a patient's laboratory results, including a complete blood count, lipid panel, glucose levels, electrolytes, liver function tests, and kidney function tests, along with urine analysis. The CDN's documentation notes several values outside the typical reference ranges, but does not clearly articulate the nutritional implications or the rationale for any subsequent recommendations. Which of the following approaches best demonstrates the CDN's adherence to regulatory requirements and professional best practices in interpreting these biochemical assessments for nutritional intervention? Option A. Focusing solely on the complete blood count and lipid panel, as these are commonly associated with diet, and considering other tests less critical for nutritional assessment. Option B. Systematically correlating all abnormal laboratory values with the patient's reported symptoms, dietary intake, and medical history to identify potential nutritional deficiencies or excesses and inform personalized nutrition recommendations. Option C. Recommending a broad-spectrum multivitamin and mineral supplement to address any potential nutrient gaps suggested by the abnormal values, without further detailed analysis. Option D. Prioritizing the interpretation of only those laboratory values that are significantly outside the reference range, while disregarding minor deviations. The correct answer is B. Systematically correlating all abnormal laboratory values with the patient's reported symptoms, dietary intake, and medical history to identify potential nutritional deficiencies or excesses and inform personalized nutrition recommendations. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified dietitian nutritionist, CDN, to interpret complex biochemical data within the context of a patient's overall nutritional status and potential deficiencies. The audit findings highlight a potential gap in the CDN's ability to synthesize laboratory results into actionable nutritional interventions, which is a core competency. The challenge lies in moving beyond simply identifying abnormal values to understanding their clinical significance and their implications for nutritional assessment and planning, all while adhering to the strict regulatory framework governing CDN practice in the specified jurisdiction. Correct approach analysis. The correct approach involves a comprehensive review of all provided laboratory values, correlating them with the patient's reported symptoms and dietary intake. This approach represents best professional practice because it aligns with the CDN's ethical and regulatory responsibility to provide evidence-based, individualized nutrition care. Specifically, it adheres to the principles of the CDN's scope of practice, which mandates the interpretation of biochemical data to assess nutritional status and identify deficiencies. This systematic evaluation ensures that interventions are targeted and effective, preventing potential harm from misinterpretation or incomplete assessment, and upholding the standard of care expected of a licensed professional. Incorrect approaches analysis. One incorrect approach involves focusing solely on a single abnormal laboratory value without considering the broader clinical picture. This is a regulatory and ethical failure because it can lead to misdiagnosis or inappropriate interventions, potentially harming the patient. It neglects the CDN's duty to conduct a holistic nutritional assessment as required by professional standards and regulatory guidelines. Another incorrect approach is to dismiss all laboratory findings as irrelevant if the patient reports feeling generally well. This is a significant ethical and regulatory failure. It demonstrates a disregard for objective biochemical data, which can reveal subclinical deficiencies or underlying health issues that may not yet manifest with overt symptoms. This approach violates the CDN's obligation to utilize all available data for comprehensive patient assessment and to act in the patient's best interest, potentially delaying necessary nutritional support. A third incorrect approach is to recommend specific vitamin or mineral supplements based on a single abnormal value without considering potential interactions, contraindications, or the patient's overall dietary pattern. This is a regulatory and ethical breach, as it constitutes prescriptive action without a thorough assessment of the patient's complete nutritional profile and medical history, which is beyond the scope of practice for a CDN in many contexts and can lead to adverse effects. Professional reasoning. Professionals should approach such situations by first understanding the specific regulatory framework and scope of practice for a CDN in their jurisdiction. This involves recognizing that biochemical data is a critical component of nutritional assessment. The decision-making process should involve a systematic review of all laboratory results, cross-referencing them with patient history, symptoms, and dietary intake. When interpreting abnormal values, professionals must consider their clinical significance, potential causes, and implications for nutritional status. If uncertainty exists or if findings suggest a medical condition beyond the CDN scope, consultation with a physician or other healthcare provider is paramount. This ensures patient safety, adherence to regulations, and the provision of high-quality, evidence-based nutrition care. Question 12. Which approach would be most appropriate for a certified dietitian nutritionist, CDN, in New York State when addressing a situation where one parent of an infant expresses significant concerns about the current feeding plan, while the other parent is satisfied with it? Option A. Prioritize the concerns of the parent who initiated the discussion, providing them with alternative feeding strategies without involving the other parent. Option B. Directly implement the feeding modifications requested by the concerned parent, assuming their concerns outweigh the other parent's satisfaction. Option C. Facilitate a joint meeting with both parents to discuss the infant's nutritional needs, address the expressing parent's concerns with evidence-based information, and collaboratively develop a mutually agreeable feeding plan. Option D. Advise the parent who is satisfied with the current plan to continue as is, and suggest the other parent seek advice from a different healthcare provider. Correct answer is C. Facilitate a joint meeting with both parents to discuss the infant's nutritional needs, address the expressing parent's concerns with evidence-based information, and collaboratively develop a mutually agreeable feeding plan. Explanation. This scenario presents a common challenge for certified dietitian nutritionists, CDN, in New York State. balancing parental autonomy with the nutritional needs of a pediatric patient. The professional challenge lies in navigating differing opinions on infant feeding practices, particularly when one parent expresses concerns that may not align with current evidence-based guidelines or the other parent's chosen approach. Careful judgment is required to ensure the infant's optimal growth and development, while respecting the family unit and adhering to professional standards. The correct approach represents best professional practice because it prioritizes a collaborative, evidence-based, and patient-centered strategy. By engaging both parents in a non-judgmental discussion, the CDN can assess the underlying concerns, provide accurate information regarding infant nutrition guidelines as established by the New York State Department of Health and relevant professional organizations, and collaboratively develop a feeding plan that addresses the infant's needs. This aligns with ethical principles of beneficence and non-maleficence, ensuring the infant's well-being is paramount and respects the family's right to make informed decisions. It also adheres to the CDN scope of practice, which includes providing nutrition counseling and education. An incorrect approach that focuses solely on the concerns of one parent without a comprehensive assessment or involving the other parent would be professionally unacceptable. This could lead to parental conflict, inconsistent feeding practices, and potentially compromise the infant's nutritional status. It fails to uphold the ethical principle of justice by not treating all parties involved equitably, and could violate the principle of autonomy by not fully informing and involving both parents in decision-making. Furthermore, it may not align with New York State regulations that emphasize family-centered care and evidence-based practice. Another incorrect approach that dismisses the concerns of one parent outright, without exploration or education, is also professionally unacceptable. This demonstrates a lack of empathy and respect for parental concerns, potentially alienating one parent and undermining the therapeutic relationship. It fails to adhere to the ethical obligation to provide comprehensive nutrition education and support, and could be seen as paternalistic rather than collaborative. Professional reasoning framework for such situations involves active listening, empathetic communication, a thorough assessment of the infant's and family's needs, and the provision of evidence-based information. CDN should strive to build trust with all family members, facilitate open dialogue, and empower parents to make informed decisions that support the infant's health. When significant concerns arise that may impact the infant's health, the CDN has a professional and ethical responsibility to address them directly and provide appropriate guidance, potentially involving other healthcare professionals if necessary, in accordance with New York State practice guidelines. Question 13. The review process indicates a client expresses a desire to improve their diet but consistently struggles with adherence, often citing a lack of motivation and feeling overwhelmed by recommendations. During a session, the client states, "I know I should eat better, but it's just so hard to stick with it. I start strong, but then something always derails me." Which of the following counseling approaches best addresses this client's expressed challenges and aligns with professional ethical guidelines for dietitians? Option A. Focus on setting ambitious, long-term dietary goals that require significant lifestyle overhaul, encouraging the client to commit to these changes through sheer willpower and a strong sense of obligation to their health. Option B. Provide a comprehensive, detailed meal plan with strict guidelines and educational materials on the benefits of each food group, emphasizing the necessity of immediate and complete adherence for optimal health outcomes. Option C. Immediately challenge the client's perceived difficulties by presenting evidence-based research on the ease of dietary adherence and the negative health consequences of continued noncompliance, urging them to adopt a more disciplined approach. Option D. Employ active listening and empathy to explore the client's ambivalence and readiness for change, utilizing motivational interviewing principles to collaboratively identify small, achievable behavioral goals and strategies that resonate with their values. The correct answer is D. Employ active listening and empathy to explore the client's ambivalence and readiness for change, utilizing motivational interviewing principles to collaboratively identify small, achievable behavioral goals and strategies that resonate with their values. Explanation. Scenario analysis. This scenario presents a common challenge in dietetics where a client expresses a desire for change, but struggles with consistent adherence due to underlying ambivalence and a lack of concrete strategies. The professional must navigate the client's resistance while fostering intrinsic motivation and empowering them to develop sustainable behaviors. This requires a nuanced application of counseling techniques that go beyond simply providing information. Correct approach analysis. The correct approach leverages principles of motivational interviewing and the stages of change model. Motivational interviewing focuses on exploring and resolving ambivalence by eliciting the client's own reasons for change, rather than imposing them. This aligns with the ethical imperative to respect client autonomy and self-determination. The stages of change model provides a framework for understanding the client's readiness to change, allowing the professional to tailor interventions to their current stage, e.g. Pre-contemplation, contemplation, preparation. Active listening and empathy are foundational to building rapport, creating a safe space for the client to express their concerns and motivations. Goal setting, when collaboratively developed, enhances commitment and provides a roadmap for action. Behavior modification strategies, chosen in partnership with the client, are more likely to be adopted when they are personally meaningful and achievable. This integrated approach respects the client's pace and empowers them to take ownership of their health journey, which is a cornerstone of best professional practice in dietetics. Incorrect approaches analysis, an approach that solely focuses on providing detailed meal plans and educational materials without addressing the client's ambivalence or readiness to change, fails to acknowledge the psychological barriers to adherence. This can be perceived as directive and may lead to increased resistance, violating the principle of client-centered care. Ethically, it neglects the responsibility to assess and address the client's motivational state. An approach that dismisses the client's expressed difficulties and immediately pushes for drastic dietary changes without exploring the underlying reasons for their struggles overlooks the importance of empathy and rapport building. This can alienate the client and undermine trust, hindering the therapeutic relationship. It also fails to adhere to the ethical guidelines that emphasize understanding the client's perspective before implementing interventions. An approach that relies heavily on external authority and dictates specific behaviors without collaborative goal setting or exploring the client's values and motivations is unlikely to foster long-term adherence. This directive style can disempower the client and may lead to a sense of failure if they cannot meet imposed expectations, which is contrary to ethical principles of promoting self-efficacy and sustainable behavior change. Professional reasoning. Professionals should first actively listen to understand the client's current perspective, including their ambivalence and perceived barriers. Empathy is crucial in validating their feelings and building rapport. Next, assess the client's stage of change to tailor the intervention. Motivational interviewing techniques should be employed to explore their motivations for change and resolve any discrepancies. Collaborative goal setting, focusing on small, achievable steps aligned with behavior modification strategies, should then be undertaken. This process empowers the client and respects their autonomy, ensuring interventions are client-centered and ethically sound. Question 14. The analysis reveals that a patient with type 1 diabetes who has been diligently practicing carbohydrate counting and adjusting their insulin doses accordingly presents with an A1C that has risen by 1.5% over the last 3 months. The patient's self-reported food logs indicate consistent adherence to their carbohydrate targets, but their blood glucose readings, while variable, are trending higher than usual, particularly postprandially. The Certified Dietitian Nutritionist, CDN, is tasked with developing a plan to address this discrepancy and improve glycemic control. Which of the following represents the most appropriate initial course of action for the CDN? Option A. Recommend that the patient discontinue carbohydrate counting for a period and focus on a more general healthy eating pattern, assuming the current method is not effective for them. Option B. Conduct a thorough review of the patient's food logs, correlating specific meals with blood glucose readings and insulin doses, and engage in a detailed discussion with the patient about their daily routine, potential stressors, and any perceived challenges with carbohydrate counting or insulin administration. Option C. Advise the patient to immediately reduce their carbohydrate intake by 25% across all meals and snacks, and suggest increasing their bolus insulin dose by 2 units for each meal. Option D. Inform the patient that their A1C increase is likely due to poor adherence to their carbohydrate counting plan, despite their self-reports, and strongly encourage them to be more vigilant. The correct answer is B. Conduct a thorough review of the patient's food logs, correlating specific meals with blood glucose readings and insulin doses, and engage in a detailed discussion with the patient about their daily routine, potential stressors, and any perceived challenges with carbohydrate counting or insulin administration. Explanation. Scenario analysis. This scenario presents a common challenge in diabetes management where a patient's self-reported adherence to a dietary plan conflicts with objective glycemic monitoring data. The professional must navigate this discrepancy while respecting patient autonomy and ensuring optimal health outcomes, all within the scope of practice for a certified dietitian nutritionist, CDN. The challenge lies in interpreting the data, understanding potential barriers to adherence, and formulating an effective, evidence-based intervention without alienating the patient. Correct approach analysis. The correct approach involves a collaborative and investigative process. It prioritizes understanding the patient's lived experience and potential barriers to carbohydrate counting and insulin therapy adherence. This aligns with the ethical principles of patient-centered care and beneficence, ensuring the intervention is tailored to the individual's needs and circumstances. By reviewing the patient's food logs, discussing their daily routine, and exploring their understanding of carbohydrate counting and insulin adjustment, the CDN can identify specific areas for improvement or recalibration. This approach is also consistent with the principles of diabetes education and self-management, empowering the patient to actively participate in their care. The CDN's role is to facilitate informed decision-making and provide evidence-based guidance, not to dictate or judge. Incorrect approach is analysis. One incorrect approach involves immediately assuming non-adherence and recommending a drastic dietary overhaul or increased medication without further investigation. This fails to acknowledge potential external factors influencing glycemic control, such as stress, illness, or changes in physical activity, which are not directly captured by food logs alone. Ethically, this approach can be perceived as judgmental and may erode patient trust, hindering future engagement. It also bypasses the crucial step of understanding the patient's perspective and challenges, violating the principle of patient-centered care. Another incorrect approach is to dismiss the elevated A1C as solely a result of poor patient compliance, and to simply advise the patient to try harder, without offering specific strategies or support. This is a failure to provide adequate professional guidance and support, which is a core responsibility of a CDN. It neglects the educational component of diabetes self-management and fails to address the underlying reasons for the discrepancy between reported behavior and outcomes. This can lead to patient frustration and a sense of hopelessness, potentially worsening glycemic control. A third incorrect approach is to focus solely on the carbohydrate counting aspect and suggest a rigid, low-carbohydrate diet without considering the patient's current insulin regimen and overall dietary preferences. This overlooks the complex interplay between carbohydrate intake, insulin action, and individual metabolic responses. It also fails to consider the patient's lifestyle and potential for long-term adherence, which is crucial for sustainable glycemic control. This approach may also inadvertently lead to nutritional deficiencies if not carefully planned and monitored. Professional reasoning. Professionals should approach such situations by first acknowledging the data and the patient's reported efforts. The next step is to engage in open-ended questioning to explore potential contributing factors. This includes a detailed review of food logs in conjunction with the patient's daily schedule, physical activity, and any recent changes in their life. The CDN should then collaboratively problem-solve, identifying specific areas where the patient may need additional education or support regarding carbohydrate counting, insulin adjustment, or other self-management strategies. The goal is to empower the patient with the knowledge and skills to achieve their glycemic targets in a sustainable and personalized manner, adhering to ethical guidelines of beneficence, non-maleficence, and patient autonomy. Question 15. Operational review demonstrates that a patient with chronic kidney disease, CKD, on hemodialysis is consistently exceeding their prescribed fluid intake, leading to recurrent fluid overload. The dietitian has previously provided standard education on fluid restrictions. What is the most appropriate next step in managing this patient's dietary adherence? Option A. Refer the patient to a nephrologist for further medical management of fluid overload, as dietary interventions appear to be ineffective. Option B. Document the non-adherence in the patient's chart and continue with the current fluid prescription, as the patient has been educated on the requirements. Option C. Conduct a detailed assessment of the patient's understanding of fluid restrictions. Explore potential barriers to adherence. G. Thirst, medication side effects, social factors, and collaboratively develop a revised, individualized plan with achievable goals. Option D. Increase the restrictiveness of the fluid prescription and provide a more stringent list of allowed fluids, assuming the patient is not taking the current recommendations seriously. The correct answer is C. Conduct a detailed assessment of the patient's understanding of fluid restrictions, explore potential barriers to adherence, e.g., thirst, medication side effects, social factors, and collaboratively develop a revised, individualized plan with achievable goals. Explanation: this scenario presents a common challenge in renal nutrition management, balancing restrictive dietary interventions with patient adherence and quality of life. The professional challenge lies in tailoring a complex, multifaceted dietary plan to an individual with chronic kidney disease, CKD, who is also undergoing hemodialysis, while ensuring it aligns with current best practices and regulatory guidelines for dietitians in the specified jurisdiction. The patient's reported non-adherence to fluid restrictions, a critical component of managing fluid overload in CKD patients on dialysis, necessitates a nuanced approach that goes beyond simply reiterating the restrictions. The correct approach represents best professional practice because it prioritizes a patient-centered, collaborative strategy. It involves a thorough reassessment of the patient's understanding, motivation, and barriers to adherence, followed by a collaborative development of a revised, individualized plan. This approach acknowledges that dietary management is not solely about prescription, but also about education, empowerment, and problem-solving. It aligns with ethical principles of beneficence and autonomy, ensuring the patient is an active participant in their care. Furthermore, it adheres to the professional standards of practice for dietitians, which mandate individualized care and ongoing assessment. Incorrect approaches fail to address the root cause of non-adherence and may lead to suboptimal clinical outcomes and potential regulatory or ethical breaches. Simply increasing the restrictiveness of the diet without understanding the patient's perspective can lead to further non-adherence and potentially compromise nutritional status. Ignoring the patient's reported struggles and proceeding with the same recommendations without investigation could be seen as a failure to provide adequate care and support, potentially violating professional standards of diligence and patient advocacy. A purely prescriptive approach, without exploring the why behind the non-adherence, neglects the crucial element of patient education and self-management, which are cornerstones of effective chronic disease management. This could be interpreted as a failure to meet the patient's needs comprehensively, potentially leading to adverse health consequences that the dietitian has a professional responsibility to mitigate. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and validate the patient's reported challenges. 2. Conduct a comprehensive reassessment of the patient's current dietary intake, understanding of recommendation, and perceived barriers to adherence. 3. Explore the patient's lifestyle, preferences, and cultural factors that may influence their ability to follow the plan. 4. Collaboratively problem-solve and revise the dietary plan, setting realistic, achievable goals. 5. Provide ongoing education, support, and monitoring, adjusting the plan as needed. This iterative process ensures that the dietary management remains effective, sustainable, and aligned with the patient's overall well-being and the regulatory framework governing dietetic practice. Question 16. Cost-benefit analysis shows that implementing a proactive, interdisciplinary nutrition support program for residents experiencing sarcopenia, dysphagia, and polypharmacy in a long-term care facility is more cost-effective in the long run than reactive interventions. Which of the following approaches best aligns with this finding and promotes optimal resident outcomes? Option A. Implementing a facility-wide, standardized high-protein supplement regimen for all residents over 75, regardless of individual needs or swallowing abilities, to broadly combat sarcopenia and malnutrition. Option B. Recommending that residents with dysphagia simply reduce their oral intake to minimize the risk of aspiration, without providing alternative nutrition support strategies. Option C. Focusing primarily on reducing food waste and labor costs by offering a limited menu with fewer texture modifications, assuming most residents can adapt. Option D. Prioritizing a comprehensive, individualized nutrition assessment for each resident, followed by the development of tailored interventions that address sarcopenia through protein and resistance exercise recommendations, dysphagia through modified textures and thickened liquids, and polypharmacy through drug-nutrient interaction screening and potential timing adjustments, all coordinated with the interdisciplinary team. The correct answer is D. Prioritizing a comprehensive, individualized nutrition assessment for each resident, followed by the development of tailored interventions that address sarcopenia through protein and resistance exercise recommendations, dysphagia through modified textures and thickened liquids, and polypharmacy through drug-nutrient interaction screening and potential timing adjustments, all coordinated with the interdisciplinary team. Explanation: this scenario presents a common challenge in long-term care settings, optimizing nutrition for residents with multiple, complex needs, including sarcopenia, dysphagia, and polypharmacy, while managing costs. The professional challenge lies in balancing evidence-based nutritional interventions with the practical constraints of a long-term care facility, ensuring resident well-being without compromising financial viability. Careful judgment is required to identify the most effective and efficient strategies. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment and intervention plan. This aligns with the ethical and regulatory mandates for dietitians to provide patient-centered care, ensuring that nutritional needs are met safely and effectively. Specifically, it addresses the interconnectedness of sarcopenia, dysphagia, and polypharmacy, recognizing that these conditions often exacerbate malnutrition. The emphasis on interdisciplinary collaboration is crucial for holistic care and compliance with regulations that often require coordinated efforts among healthcare professionals. This approach also reflects a commitment to evidence-based practice, utilizing the most current understanding of nutritional science and geriatric care. An incorrect approach that focuses solely on cost reduction without considering the clinical impact would be a regulatory and ethical failure. It could lead to inadequate nutritional intake, worsening of existing conditions like sarcopenia and dysphagia, and increased healthcare costs due to complications arising from malnutrition. This would violate the dietitian's duty of care and potentially breach regulations related to resident rights and quality of care. Another incorrect approach that overlooks the impact of polypharmacy on nutrient absorption and utilization would be professionally unacceptable. Failing to account for drug-nutrient interactions can lead to ineffective nutritional interventions and adverse health outcomes, contravening the principles of safe and effective nutrition practice. A third incorrect approach that neglects the specific needs of older adults with dysphagia by recommending standard textures or supplements without proper evaluation would be a failure to adhere to best practices for safe swallowing and adequate nutrient intake. This could result in aspiration, further decline in nutritional status, and a violation of the dietitian's responsibility to provide appropriate and safe dietary recommendations. Professionals should employ a decision-making framework that begins with a thorough resident assessment, considering all contributing factors to nutritional status. This should be followed by the development of an individualized nutrition care plan, developed collaboratively with the interdisciplinary team. Regular monitoring and evaluation of the plan's effectiveness, with adjustments as needed, are essential. This systematic process ensures that care is both clinically sound and ethically responsible, while also considering resource allocation. Question 17. During the evaluation of a 10-year-old patient presenting with concerns about picky eating and slow weight gain, what is the most appropriate initial approach for a certified dietitian nutritionist, CDN, practicing in the United States, considering potential underlying issues such as food allergies or disordered eating patterns? Option A. Focus solely on behavioral strategies to encourage the child to eat more. Assuming the picky eating is a behavioral issue unrelated to underlying medical or psychological conditions. Option B. Advise the parents to eliminate common allergens from the child's diet to rule out food intolerances without further diagnostic testing. Option C. Conduct a detailed dietary assessment, including a 24-hour recall and food frequency questionnaire, review growth charts, inquire about family history of allergies and eating disorders, and explore the child's eating behaviors and preferences, while also considering referral to a pediatrician for further medical evaluation if concerns persist. Option D. Immediately implement a strict meal plan focused on nutrient-dense foods to accelerate weight gain, as slow weight gain is the primary concern. The correct answer is C. Conduct a detailed dietary assessment, including a 24-hour recall and food frequency questionnaire, review growth charts, inquire about family history of allergies and eating disorders, and explore the child's eating behaviors and preferences, while also considering referral to a pediatrician for further medical evaluation if concerns persist. Explanation. This scenario presents a professional challenge due to the critical nature of childhood nutrition and the potential for misinterpreting or misapplying dietary guidelines, especially when dealing with sensitive issues like eating disorders and food allergies. A registered dietitian nutritionist, RDN, must navigate complex nutritional science, individual child needs, and regulatory frameworks to provide safe and effective care. The challenge lies in balancing general dietary recommendations with specific medical and psychological considerations, ensuring that interventions are evidence-based and ethically sound. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that aligns with the Certified Dietitian Nutritionist, CDN, scope of practice, and relevant U.S. federal and state regulations governing nutrition practice. This approach emphasizes gathering detailed information about the child's medical history, growth patterns, eating behaviors, and family context. It also involves consulting established, evidence-based dietary guidelines, such as those from the U.S. Department of Agriculture, USDA, and the U.S. Department of Health and Human Services, HHS, which are the primary regulatory frameworks for nutrition advice in the U.S. This ensures that recommendations are grounded in scientific consensus and meet federal standards for public health nutrition. Furthermore, it acknowledges the need for collaboration with other healthcare professionals when eating disorders or significant food allergies are suspected or diagnosed, which is a key ethical and regulatory requirement for ensuring patient safety and appropriate care coordination. An incorrect approach that relies solely on generalized dietary recommendations without a thorough assessment fails to meet the individualized needs of the child and could exacerbate existing issues. This approach is a regulatory and ethical failure because it deviates from the standard of care, which mandates personalized nutrition interventions. It also risks misdiagnosing or inadequately addressing underlying conditions like eating disorders or severe food allergies, potentially leading to adverse health outcomes, which violates the RDN's duty of care and could be seen as practicing outside their scope if they attempt to manage complex conditions without proper referral. Another incorrect approach that focuses exclusively on weight management, without considering the psychological and behavioral aspects of eating, is a significant ethical and regulatory failure. In the context of childhood nutrition, particularly when eating disorders are a concern, a singular focus on weight can be detrimental and is contrary to current best practices and ethical guidelines that promote a health-at-every-size approach and a holistic view of well-being. This approach can contribute to disordered eating patterns and negative body image, violating the RDN's responsibility to promote health and prevent harm. It also fails to adhere to guidelines that emphasize a multidisciplinary approach to eating disorders. A third incorrect approach that dismisses parental concerns about potential food allergies without further investigation is a regulatory and ethical failure. The RDN has a professional obligation to take patient and family concerns seriously and to conduct appropriate assessments. Ignoring such concerns can lead to delayed diagnosis and management of potentially serious conditions, putting the child's health at risk. This approach violates the principle of patient-centered care and the RDN's responsibility to provide thorough and responsive nutrition counseling, potentially contravening state regulations that outline the scope of practice and professional conduct for dietitians. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive assessment. Begin with a thorough evaluation of the child's medical history, growth parameters, dietary intake, eating behaviors, psychosocial factors, and family history. 2. Evidence-based guidelines. Consult current reputable dietary guidelines, e.g., Dietary Guidelines for Americans and position papers from professional organizations. 3. Individualization. Tailor recommendations to the specific needs, preferences, and circumstances of the child and family. 4. Collaboration. Recognize the importance of interdisciplinary teamwork and seek consultation or referral to other healthcare professionals, e.g., pediatricians, psychologists, allergists, when indicated. 5. Ethical considerations. Uphold ethical principles of beneficence, non-maleficence, autonomy, and justice in all aspects of practice. 6. Regulatory awareness. Ensure all practice adheres to the specific federal and state laws and regulations governing nutrition and dietetics in the relevant jurisdiction. Question 18. Quality control measures reveal that a patient diagnosed with type 2 diabetes mellitus, who was previously provided with a meal plan utilizing carbohydrate counting and exchange systems, is now expressing significant confusion and frustration, stating they just don't get it and are finding it too difficult to follow. The patient is concerned this difficulty is preventing them from managing their blood glucose effectively. As the Certified Dietitian Nutritionist, CDN, responsible for this patient's care, what is the most appropriate initial approach to address this situation? Option A. Advise the patient to disregard the carbohydrate counting and exchange systems for now and focus solely on reducing all carbohydrate intake to the lowest possible level until they can better understand the system. Option B. Schedule a follow-up appointment to re-educate the patient on the principles of carbohydrate counting and exchange systems, explore their specific challenges and perceived barriers, and collaboratively develop practical strategies for implementation that align with their lifestyle and the physician's recommendations. Option C. Provide the patient with a generic handout detailing the biochemical pathways of glycolysis and gluconeogenesis to enhance their theoretical understanding of carbohydrate metabolism. Option D. Reiterate the original meal plan and emphasize the importance of strict adherence, suggesting that the patient may not be motivated enough to manage their condition effectively. The correct answer is B. Schedule a follow-up appointment to re-educate the patient on the principles of carbohydrate counting and exchange systems, explore their specific challenges and perceived barriers, and collaboratively develop practical strategies for implementation that align with their lifestyle and the physician's recommendations. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the Certified Dietitian Nutritionist, CDN, to navigate a complex patient situation involving a diagnosed disorder of carbohydrate metabolism, type 2 diabetes mellitus, and a potential misunderstanding of dietary recommendations. The challenge lies in ensuring the patient receives accurate, evidence-based guidance that aligns with their medical condition and promotes safe, effective management, while also respecting their autonomy and addressing their perceived barriers to care. The CDN must balance the need for strict adherence to medical advice with the patient's ability to implement changes. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient education and collaborative goal setting, grounded in the principles of evidence-based nutrition practice. The CDN is acting within their scope of practice by assessing the patient's understanding, identifying potential barriers, and tailoring recommendations. This approach directly addresses the patient's stated confusion regarding carbohydrate counting and exchange systems, which are critical tools for managing type 2 diabetes. By offering to re-educate the patient on these systems and explore practical strategies for implementation, the CDN is facilitating adherence and empowering the patient to make informed choices. This aligns with ethical principles of beneficence, acting in the patient's best interest, and autonomy, respecting the patient's right to make decisions about their care. Furthermore, it adheres to the regulatory framework for CDNs, which mandates providing competent, evidence-based nutrition care and engaging in patient-centered education. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the patient's concerns and reiterating the original dietary plan without further investigation. This fails to acknowledge the patient's expressed difficulty and potential lack of understanding, which is a critical barrier to adherence. Ethically, this approach can be seen as a failure of beneficence, as it does not adequately address the patient's needs or potential for improved health outcomes. It also risks undermining patient trust and autonomy by not engaging in a dialogue to understand their perspective. Regulatory failure occurs if this leads to suboptimal patient management due to unaddressed barriers. Another incorrect approach might involve recommending a drastic, overly restrictive carbohydrate diet without a thorough assessment of the patient's current intake, lifestyle, and the specific recommendations from their physician. This could be dangerous, potentially leading to hypoglycemia or other adverse effects, and goes beyond the scope of general advice without specific medical direction. This approach violates the principle of non-maleficence, do no harm, and could be a regulatory failure if it leads to patient harm or deviates from established medical guidelines for diabetes management. A third incorrect approach could be to simply provide generic information about carbohydrate metabolism, without addressing the patient's specific confusion about carbohydrate counting and exchange systems. While factually correct, this fails to be patient-centered and does not solve the immediate problem the patient is facing. It neglects the practical application of knowledge needed for self-management of their condition, which is a core responsibility of a CDN. This represents a failure in providing effective, tailored nutrition counseling and could be considered a regulatory lapse in delivering appropriate care. Professional reasoning. When faced with a patient expressing confusion or difficulty with a dietary plan, especially one related to a chronic condition like diabetes, a CDN should employ a patient-centered, problem-solving approach. This involves active listening to understand the patient's perspective and identify specific barriers. The next step is to assess the patient's current knowledge and skills related to the dietary recommendations. Based on this assessment, the CDN should then collaboratively develop a plan that may involve re-education, skill building, modification of the plan, within medical guidelines, or referral to other professionals if necessary. The ultimate goal is to empower the patient to achieve their health goals safely and effectively, in accordance with their medical treatment plan and within the CDN's scope of practice and ethical obligations. Question 19. The assessment process reveals that a client seeking weight management advice expresses a strong aversion to consuming adequate protein, citing a belief that all protein sources are unhealthy and will hinder their fat loss goals. The registered dietitian nutritionist, RDN, understands that sufficient protein intake is crucial for satiety, muscle preservation during calorie restriction, and supporting metabolic rate, all of which are vital for the client's stated objectives. The client insists on a very low-protein, high-carbohydrate diet. What is the most ethically sound and professionally appropriate course of action for the RDN in this situation? Option A. Strongly advise the client that their dietary preference is scientifically unsound and will prevent them from achieving their goals, insisting they follow a high-protein diet as recommended by the RDN. Option B. Respect the client's stated preference for a very low-protein, high-carbohydrate diet without further discussion, as client autonomy is paramount, and focus solely on calorie restriction. Option C. Recommend a high-carbohydrate diet and suggest the client seek advice from a different practitioner who may be more aligned with their dietary beliefs. Option D. Gently educate the client on the role of protein in satiety and metabolism, explaining how appropriate protein sources can support fat loss and muscle maintenance, and collaboratively develop a meal plan that incorporates their preferences while gradually introducing suitable protein options. The correct answer is D. Gently educate the client on the role of protein in satiety and metabolism, explaining how appropriate protein sources can support fat loss and muscle maintenance, and collaboratively develop a meal plan that incorporates their preferences while gradually introducing suitable protein options. Explanation. This scenario presents a professional challenge because it involves a conflict between a client's expressed preferences and the registered dietitian nutritionist's, RDN, evidence-based professional judgment regarding nutrient metabolism and its impact on the client's health goals. The RDN must navigate this situation ethically and within the scope of practice defined by the Certified Dietitian Nutritionist, CDN, credentialing body, and relevant state regulations. The correct approach prioritizes the client's well-being and long-term health outcomes, aligning with the ethical principles of beneficence and non-maleficence. It involves open communication, education, and collaborative goal setting. By explaining the scientific rationale behind macronutrient recommendations and their role in achieving the client's stated goals, the RDN upholds their professional responsibility to provide evidence-based nutrition care. This approach respects the client's autonomy while ensuring they receive accurate and safe guidance, consistent with the standards of practice for RDNs. An incorrect approach that dismisses the client's preferences without adequate explanation or attempts to impose a rigid plan, without considering the client's lifestyle or beliefs, would be ethically problematic. It could be perceived as paternalistic and may lead to poor adherence and client dissatisfaction. Failing to address the client's concerns about specific macronutrients or providing information that is not scientifically supported or is misleading would violate the RDN's duty to provide accurate and competent care. Such actions could also contravene regulations regarding professional conduct and scope of practice, which mandate evidence-based practice and client-centered care. Professionals should approach such situations by first actively listening to and acknowledging the client's concerns and preferences. Then, they should clearly and respectfully explain the scientific basis for their recommendations, focusing on how macronutrient metabolism influences the client's specific health goals. This educational component empowers the client to make informed decisions. Collaborative goal setting, where the RDN and client work together to develop a realistic and achievable plan that incorporates both evidence-based principles and client preferences, is crucial. If a client's preference poses a significant health risk or is scientifically unfounded, the RDN must clearly articulate these concerns and explore alternative strategies that are both safe and effective. Question 20. Regulatory review indicates that a certified dietitian nutritionist, CDN, is consulting with a client who expresses a strong interest in taking a specific trace mineral supplement, citing information they encountered online. The CDN's primary responsibility is to provide evidence-based and safe nutritional guidance. Which of the following approaches best aligns with the CDN's professional obligations and the regulatory framework governing their practice? Option A. Suggest the trace mineral supplement based on its popularity and positive testimonials found on the same website the client referenced, without independent scientific verification. Option B. Advise the client that online information is unreliable and dismiss their interest in the supplement without further investigation, focusing only on general dietary advice. Option C. Immediately recommend the trace mineral supplement as requested by the client, assuming their online research is accurate and their interest signifies a need. Option D. Conduct a thorough dietary assessment to evaluate the client's current intake of major and trace minerals. Research the scientific evidence for the efficacy and safety of the specific trace mineral supplement, and discuss the findings, potential risks, and benefits with the client before making any recommendations. The correct answer is C. Immediately recommend the trace mineral supplement as requested by the client, assuming their online research is accurate and their interest signifies a need. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified dietitian nutritionist, CDN, in navigating the complex landscape of mineral supplementation recommendations, particularly when a client expresses interest in a specific, potentially unproven, supplement. The challenge lies in balancing client autonomy and expressed desires with the CDN's ethical and professional responsibility to provide evidence-based, safe, and appropriate nutritional guidance. The CDN must critically evaluate the client's request against established scientific literature and regulatory guidelines for dietary supplements, ensuring that any recommendation aligns with the client's overall health status and potential risks. Correct approach analysis. The correct approach emphasizes a thorough, evidence-based, and client-centered evaluation. This involves first assessing the client's current dietary intake of major and trace minerals through a comprehensive dietary assessment. This is crucial because many mineral deficiencies or excesses can be addressed through diet alone. Following this, CDN should investigate the scientific evidence supporting the efficacy and safety of the specific mineral supplement the client is interested in, referencing peer-reviewed literature and reputable scientific databases. The CDN must then consider the client's individual health status, including any existing medical conditions, medications, and potential for mineral interactions, as per established nutritional science and guidelines relevant to CDN practice. Finally, the CDN should engage in a shared decision-making process with the client, clearly explaining the evidence, potential benefits, risks, and alternatives, empowering the client to make an informed choice. This approach aligns with the CDN's ethical obligation to practice within their scope, prioritize client well-being, and adhere to principles of evidence-based practice, as implicitly supported by professional standards and the regulatory framework governing CDN practice, which prioritizes client safety and informed consent. Incorrect approaches analysis. Recommending the supplement without a thorough dietary assessment or scientific evidence review is a significant regulatory and ethical failure. It bypasses the fundamental principle of individualized nutrition care and could lead to inappropriate supplementation, masking underlying dietary issues, or even causing harm through toxicity or adverse interactions. This approach disregards the CDN's responsibility to provide evidence-based recommendations and could be seen as promoting unverified health claims. Directly dismissing the client's request without exploration or explanation is also professionally problematic. While the CDN has a duty to provide accurate information, a dismissive attitude can erode client trust and hinder effective communication. It fails to acknowledge the client's agency in their health decisions and misses an opportunity for education and collaborative problem-solving. Ethically, it can be perceived as paternalistic and not conducive to a therapeutic relationship. Suggesting the supplement solely based on anecdotal evidence or marketing claims is a critical failure. This approach directly contradicts the requirement for evidence-based practice, which is a cornerstone of professional CDN conduct. Relying on non-scientific sources can lead to recommendations that are ineffective, potentially harmful, and violate the trust placed in the CDN as a qualified health professional. It also opens the door to potential legal ramifications if the supplement causes harm. Professional reasoning. Professionals should approach such situations by initiating a comprehensive assessment of the client's current nutritional status and dietary habits. This forms the foundation for any subsequent recommendations. Next, a critical evaluation of the scientific literature pertaining to the specific mineral and its supplementation is essential, focusing on efficacy, safety, and dosage. The CDN must then consider the client's unique health profile, including comorbidities and concurrent medications, to identify potential interactions or contraindications. Finally, open and transparent communication with the client is paramount, involving a discussion of findings, evidence, risks, benefits, and alternative strategies, fostering a collaborative approach to decision-making that respects client autonomy while upholding professional standards.